of my two-part talk, I will share some use of AI in solving some major problems with global healthcare. Many people believe AI is humanity's best and probably only hope in solving our global healthcare problem. AI's best gift to humanity might just be better health for everyone. In 2015, the United Nations established a Sustainable Development Goals, which is to be achieved by year 2030. One of the goals is goal number 3, which is to ensure healthy lives and promote well-being for all at all ages. And that includes universal health coverage, equitable access of healthcare service to all men and women. Good health is important because it impacts and contributes to all other 16 goals. However, achieving goal number 3 almost seems impossible unless we leverage digital technologies and AI. The current situation with global health is not good. Roughly 3.5 billion people, more than half the world's population, do not have access to essential health services. To achieve United Nations goal for good health and well-being, we need at least 80 million healthcare workers by 2030. However, we're short of 15 million right now. Unless we're able to train up lots of new nurses and doctors immediately, we need another, more scalable approach. AI seems to have potential to alleviate this problem. Not only do we not have enough healthcare workers, but they are not evenly distributed. Third world countries have a disproportionate less number of doctors and nurses, even though the population is much more. The chart shows that more than half, 57% of the healthcare workers are located in the Americas and Europe, even though the population is only roughly 20% of the world population. This chart also shows that the lack of doctors and nurses translate to shorter lives, i.e. the dailies. The healthcare problem is escalated by the fact that the world population is aging quickly. We just passed a turning point where there are now more old people, 65 or older, than young people. This means there will be fewer people to take care of the elderly. On top of that, the healthcare costs have skyrocketed. It is particularly worse for US. It has gone from 5% to 17% of GDP. Healthcare expenses have become unaffordable in many, even in the first world countries like US. Technology like AI and machine learning are highly scalable. Once you develop an AI model, it could be reused millions of times with very low incremental costs. This piece of fact might surprise you, but the third leading cause of death in US after heart disease and cancer is actually medical errors. Each year, a quarter of a million to over 400,000 people die from mistakes, and most of the mistakes are avoidable. This is from a 2016 study by Johns Hopkins and a 2013 study published in the Journal of Patient Safety. The types of error could be simple human errors, communication problems, or inaccurate information flow. Many of these errors could be spotted easily by using AI. In healthcare, there is this concept of iron triangle, which refers to the idea that easy access, affordable cost, and quality care cannot all be simultaneously achieved. For example, you can have easy access to healthcare and high quality healthcare services, but it would be very expensive. Alternatively, you may have low cost healthcare and easy access, but the quality may be lacking. Many believe technologies like AI and machine learning can break the iron triangle, whereby general populations can have their cake and eat it too. Achieve easy access, low cost, and quality service. Technologies like AI and machine learning might be humanity's only way to achieving United Nations goal number 3 by 2030. There are many examples of how AI can help tackle the iron triangle. In this talk, I will only have time to give two major examples, the use of AI chatbot doctors and the growing popularity of telemedicine. There are many AI medical chatbots in the market, and investors are investing heavily in this area. For example, Babylon Health, based in London, have received over 635 million in funding and is valuated over 2 billion. These AI chatbots are very different from the simple customer support chatbots you commonly see on the web. These AI chatbots are encoded with rich knowledge of the medical domain using both structured and potentially unstructured knowledge sources that represent decades of human knowledge in medicine. First, full disclosure, the company that I work for, which is Prudential Corp Asia, uses Babylon Health AI chatbot, but we provide it free of charge to countries in Southeast Asia, including Hong Kong. One example source of medical knowledge is SNOMED, which is systemized nomenclature of medicine, basically a structured encyclopedia of medical terms and knowledge that started 55 years ago. It is used to provide a standardized way to identify symptoms and diseases so that medical professionals around the world speak the same language, so to speak. The 2020 edition has over 350,000 concepts and roughly 1.4 billion linked relationships, such as relationship between symptoms and diseases. The NCI Meta Thesaurus is another comprehensive biomedical terminology database that provides a broad concept-based mapping of terms from over 100 biomedical terminologies with 7.5 million terms mapped to 3.2 million concepts. ICD-11, International Classification of Disease, is yet another ontology with over 1.6 million terms providing 17,000 diagnostic categories with over 100,000 medical diagnostic index terms. Babylon Health, for example, makes use of these and other ontologies, as well as input from teams of doctors around the world to form a probabilistic and causal AI model, which is called a knowledge graph. It has two such knowledge graphs, one to represent medical knowledge and the other to represent the patient's detail and medical record and history. The following short 2-minute video shows how Babylon Health's symptom checker works using Amazon Alexa to talk to a patient to extract symptoms and determine potential illnesses.
Alexa, I want to talk to Babylon.
Hi there, I'm Babylon and I'm here to help. To start, tell me what symptom is bothering you the most.
Well, I've got quite a sore stomach.
Sorry to hear that. Let's figure out what's causing your pain and how to treat it. Chris, where exactly is the pain?
It's kind of on the top part of my stomach, sort of in the middle.
And how bad is the pain?
Oh, it's not too bad.
And does it come and go?
Yeah, it comes and goes, and it's worse after eating.
I see. How would you describe the pain?
Sort of feels like a burning pain.
Okay. And are you feeling sick?
Yeah, a little bit.
Have you vomited at all?
No?
Have you noticed you're feeling fuller sooner than usual?
No.
How long have you had this pain?
A few months? 3 months, maybe?
Are you still a non-smoker?
Yes.
Okay, that's great. Have you been taking any of your ibuprofen tablets the last few days?
Yeah, I have.
Thanks, Chris. I know enough now to offer information on what may be causing your symptoms. It could be acid reflux or a peptic ulcer. I'd recommend speaking to a GP soon. They're likely to prescribe something called the proton pump inhibitor to control your stomach acid. I can then get this prescription to your home using your Amazon Prime.
Okay, thanks, Babylon.
My pleasure. Thanks for using Babylon with Alexa. Goodbye.
That was an amazing demo, right? Babylon Health is only one such company. There are many more using roughly similar approaches. For example, Ada Health is another, and it has around 11 million users. At first, it was developed as a tool to support doctors in making diagnoses. A couple of years ago, Ada Health decided to let consumers use it as an AI chatbot to understand and manage their own health. According to Ada Health, roughly one patient assessment is done every 3 seconds. Quite impressive. We can talk to both Babylon and Ada for free, so give it a try later on when you have time. AI chatbot doctors makes medical knowledge easily accessible to anyone. But if AI doctors say that you should see a human doctor, in many countries you can now use telemedicine to consult with your doctor via your smartphone. This has been particularly popular during COVID-19. There are many companies around the world offering telemedicine services. In Singapore, one of these companies is MyDoc. This chart shows the rapid growth of telemedicine due to pandemic in Singapore. In Australia, for example, over 10 million people have signed up for telehealth services from over 76,000 providers. In total, over 28 million COVID-19 related telehealth services have been provided. In the United States, the United States government made telehealth available via Medicare temporary in March, and telehealth skyrocketed from only 11,000 to 1.3 million in April. The Trump administration have now made telehealth permanent benefit in Medicare for rural areas of the United States. The British government also made telemedicine available to its citizens, and adoption has skyrocketed as well. In this interesting quote, 10 years of change in just 1 week truly represents the difference a week makes for telemedicine. Who could have guessed how fast telemedicine will be embraced by regulators and governments around the world? Cree is an example of telehealth service provider. It's Stockholm-based digital healthcare company, and it's one of Europe's largest. Over 1.8 million teleconsultations have been performed to date. Health Hero is another example. It is London-based and provides GP, mental health, musculoskeletal, and specialist video consultations. It has performed over 1.5 million consultations, and the company only started just 1 year ago. Babylon Health, which we talked about earlier, has also provided telemedicine for UK's NHS in London and Birmingham. You might wonder what AI has to do with telemedicine. Actually, AI has great potential use to support doctors during a video call. In this demo from Babylon Health, it shows that AI facial analytics detects the emotion of the patient and gives human doctors suggestions for questions to ask. AI automatically displays relevant clinical codes for doctors' reference, as well as use natural language processing to record transcript of the entire conversation. The prescription is automatically extracted from the conversation as well. At the end, AI automatically composes a summary of the doctor's consultation note. In the following short 2-minute video shows how this process works.
Hi Louise, my name's Dr. Kultag Archer. Nice to meet you.
Hi, nice to meet you too.
So I can see you've completed our AI assessment, and from this, can I confirm that you've been having dizziness for a few months now with some hearing loss and also some ringing in your ears?
Yeah, that's right.
Okay, you look quite comfortable at the moment, so does the dizziness come and go?
Yeah, I don't have it at the moment.
Okay, and when you do get the dizziness, how long do the symptoms last?
A few hours at a time, I'd say, probably. Yeah.
Okay, and does changing the position of your head bring on the dizziness? Sorry, what I mean to say is, do you get dizzy, for example, when you turn your head to look to one side or when you turn over in bed?
Oh, okay, no.
Have you felt sick or vomited when you get the dizziness?
No.
Okay. And is there anything else you wanted to tell me about your symptoms? For example, have you had any headache, any weakness, any numbness at all?
No.
Okay. According to our records, you also had glandular fever a few months ago. Has that all settled?
Yeah, that was awful. That's gone now.
Great. I mean, just looking at the blood test results from back then, they all came back normal as well.
Great.
So I would agree with our AI assessment. It looks like your symptoms are being caused by an ear condition called Meniere's disease. This causes a buildup of pressure within the balance center, and that's what causes those awful dizzy episodes that you've been getting.
Okay.
The most important thing now is to relieve those awful symptoms. So I'd like to prescribe something called prochlorperazine. Can I just double check you're not pregnant at all?
No chance of that.
And you're not allergic to any medications?
No.
Okay. So I'll send that prescription to your usual pharmacy. It'll take around an hour or so.
Okay.
Does that all sound okay?
It sounds a little bit serious.
Well, as you found out, the symptoms can be really serious when you have them, but many years itself usually isn't, and it can be really well managed with the medication.
Okay, thanks.
One thing to mention, given that it looks like you do have Meniere's disease, this could put you at a high risk of getting migraines. So I'd like you to do our migraine risk assessment, and that way we can see if there's anything that we can help you to reduce your risk.
Okay, yeah, I'll definitely do that.
Great. Okay, so I'll just run through the next steps confirming your diagnosis and how to take the medication safely.
Early on, I mentioned that AI has the potential of breaking healthcare's iron triangle and making healthcare more accessible. The following slides are some examples of this. Africa has 10% of the world's population, 25% of the world's disease burden, but only 3% of the world's doctors. Ada Health's Global Health Initiative, which was funded in part by Bill and Melinda Gates Foundation, translated their AI doctor app into Swahili. The Swahili-speaking East African country of Tanzania has a population of 59 million, with only one doctor per 25,000 people. Life expectancy is low, and a third of the population do not live nearby health facilities. The AI chatbot is not meant to replace human doctors, but to reduce unnecessary clinic visits by providing health information and triaging patients. Rwanda is another country in Africa that is benefiting from AI Doctor. It has a population of 12.3 million. The project by Babylon started in 2016 in partnership again with Bill and Melinda Gates Foundation. Initially, it provided 1 million consultations, and now it has expanded to cover all Rwandans aged 12 and over as part of the government's community-based health insurance scheme. The partnership will use digital-first approach to create Africa's first universal prime care service and making Rwanda a world leader in digital health. The way it works is that patients consult with a doctor or nurse within minutes over their mobile phone via text messages or voice calls because many people do not have smartphones. Medical staff then use Babylon's AI doctor for triage and symptom checking. The service also allows patients to receive prescription, lab requests, and referral all through their phone. This allows patients to have greater control over their own health, faster treatment, and fewer trips to health facilities. Ping An's Good Doctor has a 1-minute clinic is another example of making healthcare more accessible in rural areas where there are roughly only 1 to 2 doctors per 1,000. The clinic is basically a box with one half a vending machine for medicine and the other half a small booth to talk to a doctor via a video. Patients first talk to an AI chatbot to provide basic medical history and symptoms, and the AI generates a diagnostic plan. It then hands it off to a human doctor for teleconsultation. The user can pick up prescription immediately via the vending machine, which stocks around 100 commonly used medicines. If medicine is not available, it could be delivered. This system is great for rural areas as being installed in enterprises, large communities, universities, chain pharmacies, and expressway service areas, etc. It is also expanding overseas, such as in Indonesia, where there is only 0.3 doctor per 1,000 population. For my last slide, I just wanted to highlight that we need to always be mindful of AI governance. For AI to do good, we need to also respect data privacy and to ensure that AI is fair and not biased, with transparency in how it makes recommendations, as well as being safe and secure. So that ends part 1 of my talk. In part 2, I will talk about how AI is being used to fight the pandemic. Thank you.